Okay, for the posture analysis, I'm going to have you face that wall for me, and looking at the acromion, I'm looking for a greater sway than 1/4 of an inch. For PDA sway, which would be indicative of a category 1. If I can have you face that wall for me. Then looking at the S2 tubercle, I'm looking for a lateral sway of greater than 1/4 of an inch, and this would be indicative of a category 2. And then if normal sway is less than 1/4 of an inch, and if there is no sway due to guarding, that is indicative of a category 3. If I can have you sit and face that wall for me, checking the first rib, and I will have the patient slowly flex and extend his head, and then I'm looking for rib jump greater than 1/4 of an inch. On one side would be indicative of a category 2. If both jumped greater than 1/4 of an inch, that would be indicative of a category 1. And then if there is no movement due to guarding, that would be indicative of a category 3. Okay, if I can have you lay on your back for me. We're checking for cervical indicators, and here we are checking for tenderness on the spinous and TVPs of the cervical spine. If I find a tender spot on the spinous, that would be relative to TVP inferiority in the lumbars. And then if I find it on the TVP, it would be indicated of rotation in the lumbars on that side. And then from there, I will do the cervical compaction test. I'll lift your head up. And then if I can have you lift your feet 18 to 24 inches off the table, noting the difficulty here. And then pushing on the sagittal suture, if I can have you redo that for me and note the level of difficulty. Perfect. And which one do you think was more difficult?
The first one was easier.
First one was easier, which if it's easier, easier once you're pushing down on the sutures, that would be relative of a cervical issue. If it was harder the second time around, that would be indicative of a lumbar issue. And since it was easier, we will go through and do the cervical stair step, which we will check all the 4 levels in the cervical spine. The first level is T1 and C7, and if I note difficulty there, I would check for anteriors of T1 through T4, fix those, and then come back and recheck. And then, so we'll do T1, C7, 5 and 6, 4 and 3, and 2 and 1. And then let's see, like right in here. And then from here, keeping the nose parallel to the table, we will do a figure 8 for correction. And then trying to take it as far as we can. And then we will go back and recheck. And it's a more smooth motion. Okay, for testing for, or for doing a basic one, I will have my fingertips spreading from the EOP to the inferior nuchal line. And then I will be waiting for the pulsations to equalize. And then moving on to basic 3, I will be palpating the sagittal suture, looking for a tender spot. Right here. And then I will cross my thumbs, placing them on the opposite sides of the sagittal suture, and then placing my hands on the parietal bones. And then on inhalation, I will be lifting the parietal bones while separating the sagittal suture. If I can have you inhale and exhale, inhale can do that for 3 respiratory cycles. Okay, we will be checking the psoas. If I can have your wrist, making sure that the patient is not wearing a watch or belt. I'll pull back below the wrist, bring them together. And then the right one is shorter, which is indicative of a tight psoas on that side. You put your hands down. If I can have you lift your right knee for me. May I go under your knee to stabilize the hip?
Yep.
And for category 2, I will be pulling the hip down and then pushing P to A on the psoas. So if I can have you inhale, exhale, and then dig down, and then hold, and then inhale again, dig deeper, and then once more. And then from there, we will, you can place your hip down. We will recheck, and then place them together, and that's even. Now, for a cat 1 and 2, we will do the exact same test. Back together, and then they're about even. We'll redo this right side. If I can have you bring your knee back up, and then here I just stabilize the knee, and then on inhalation, I will pull his knee lateral, and then exhale, I'll bring it back in while going A to P on the psoas. So if I can have you inhale, and then exhale, and then and then we will recheck and place your knee down, and then oops, and they're even. Checking for the anterior iliofemoral, I will have the patient supine, and I will be checking for internal rotation. And it looks like this right side's a little bit more restricted, so I'll step on the contralateral side. I will be contacting 1 inch superior and posterior to the greater trochanter. And then if I can have you internally rotate your foot for me, and then as you externally rotate slowly, I will be pulling on this ligament, and then relax, perfect, once more. And then on this last one, I will want you to go as fast as you can. So on 1, 2, 3, and I will pull that. And then we will recheck, and it's good to go. Okay, for the arm fossa test, if I can have you lift your right arm for me, and in a soft fist, I will be testing this muscle, just good to go. And then I will be testing for the higher fossa on the right, and that's strong. If I can have you with your opposite hand find your pubic bone for me, and then you can remove your hand, and then that one's strong as well. And keeping this one test. Oh, and then the upper fossa on this side, and then if I can have you find your pubic bone for me again, then you can remove your hand. Test the lower fossa, and if any of these were weak, it would be indicative of a category 3. 2. Cat 2.